Okay, let's unpack this. Have you ever felt that intense, piercing cold? Maybe when the wind bites.
Oh,
It
yeah.
goes beyond just feeling chilly, right?
Yeah.
But what's actually happening inside your body, like at a cellular level when tissue freezes?
Right. That's the crucial part.
We've taken a deep dive into a stack of sources here. Medical research, historical military records, really trying to understand frostbite.
It's definitely not just getting cold. It's a complex injury. Serious impacts and critical treatments are needed, often fast.
Exactly. So whether you're maybe facing extreme conditions or you're just curious about the medical science or, want to understand this hidden winter danger, this deep dive is for you.
We're going to look at the science, how cold physically damages tissue. It's quite fascinating, actually.
And why something simple like wind chill, massively increases the risk, and what the latest research says about treating it, preventing it.
And here's where it gets really interesting. What's fascinating from these sources is how they detail the injury process itself.
Okay.
So it starts when your skin temperature actually drops below freezing. Think of it like this. Water in the fluid between your cells.
Yeah.
Even within your blood vessels, it starts to crystallize, forms tiny ice shards.
Wait, actual ice crystals inside your body? That sounds incredibly destructive.
Yes, yeah. These crystals, they physically damage the delicate membranes of your cells. But the process is even more insidious, really.
How so?
Well, as that fluid outside the cells freezes, it actually draws water out of the cells, kind of like osmosis.
Oh, okay.
So the cells dehydrate, they shrink,
Mm-hmm.
and that disrupts all their normal functions.
Wow, so it's a double whammy then. Freezing damage and drying the cells out from the inside.
Exactly. And the damage, it doesn't stop there. The cellular injury, it triggers a really powerful inflammatory response.
The body tries to fix it.
Right. Rushes in to try and fix things. But this can kind of ironically make it worse. It leads to tiny blood clots forming in the small vessels, microclots.
Which cuts off blood flow. So the tissue isn't getting oxygen or nutrients anymore.
Precisely. That lack of blood flow ischemia, that's the technical term. It ultimately starves the tissue. And that can lead to tissue death, necrosis.
And I read that some tissues are hit harder than others.
That's right. What's surprising is nerves, cartilage, the lining of blood vessels, they seem to be damaged more quickly than skin or fat.
That seems counterintuitive.
A bit, yeah. And it's particularly concerning in, say, growing bones. Damage to the growth plates can have really long-term effects.
Looking at the historical sources you mentioned, this isn't just a modern medical curiosity, is it?
Oh, absolutely not. Military history gives us some really stark examples.
Like?
Wait, you see accounts from ancient times like Xenophon's retreat or Hannibal crossing the Alps. But more recently, think Napoleon's retreat from Moscow. Thousands lost to the cold.
Right, I've heard about that.
Or even the Korean War, the Chosin Reservoir battle.
Yeah.
Cold injuries just devastated troop strength. It really highlights how critical cold weather protection is. It's about capability, survival, not just comfort.
And modern data shows it's still a real issue, right? Affecting certain groups more.
It does, yeah. While overall rates in, say, the U.S. military seem relatively stable, studies do indicate younger personnel, women, and, interestingly, certain racial groups, particularly black service members, show higher rates.
Any idea why?
The sources don't definitively say, but it warrants more investigation.
Uh-huh.
And, unsurprisingly, the hands and feet are still the most common spots. Makes sense, given their exposure.
So when someone actually gets frostbite, how do you tell how bad it is? I imagine it looks different right away versus, after warming up.
That is a key point from the sources, a really key point. Initially, the affected area is often numb, feels firm, maybe looks pale, waxy, or kind of discolored.
Yeah.
But the real assessment, that comes after rewarming. As blood flow potentially returns, and this is a bit paradoxical, it can cause further injury, and significant pain and swelling. Then blisters form. And their appearance, like, are they clear or are they dark, blood-filled? That gives crucial clues about how deep the damage goes and helps predict the long-term outcome.
So you really can't jump to conclusions based on how it looks right at the start.
Correct. That initial look isn't the final word at all. And this is why the medical sources talk about using advanced imaging, like specialized scans, maybe several days after the rewarming.
To see underneath.
Exactly. These techniques let clinicians see the true extent of the tissue damage, how much is still viable. It helps figure out the likelihood of complications, like needing an amputation. It gives a much clearer picture than the older simple degree system, like for burns.
Okay, so once it's diagnosed, how is it treated? Is it just about warming the tissue back up?
Rewarming is absolutely the crucial first step. But, and this is vital, it has to be done carefully. The sources are very clear. Only rewarm if you can keep the tissue warm afterwards.
Why is that?
Because repeated freezing and thawing cycles are incredibly damaging. Really hammers the tissue.
Okay, so how should it be done?
The recommended method is rapid rewarming. Usually in circulating warm water, ideally around 37 to 39 degrees Celsius, so just above body temperature.
Got it. And beyond just warming?
Reducing inflammation and trying to restore blood flow are key. So, common anti-inflammatory meds like ibuprofen are usually recommended early on.
Okay.
And for more severe cases, research highlights some promising newer treatments. Specifically, drugs that help break up those tiny blood clots we talked about. Thrombolytics.
Like clot busters.
Exactly, like the ones used for heart attacks or strokes. If they're given early enough after rewarming, ideally within a few hours, these medications can significantly improve outcomes. Maybe even reduce the need for amputation. It's definitely a race against time to restore circulation.
Which really underlines that prevention seems paramount then, doesn't it? Considering the potential for serious lasting damage.
It absolutely is. The sources really emphasize that. Proper clothing is your first line of defense.
Layers are essential.
Layers, right. And wind protection. Critically, keeping clothing dry. Wet clothing just sucks heat away from your skin so much faster than dry. Dramatically increases risk.
So material choice matters.
Definitely. Materials like wool or synthetics, they insulate better than cotton, especially when they get damp. Cotton just stays wet and cold.
That brings up wind chill again. How does that factor in if the actual air temperature isn't changing?
That's a great point. Wind chill isn't about the air getting colder itself. It's about how quickly that moving air strips heat away from your exposed skin.
Ah, the rate of cooling.
Precisely. A strong wind makes the effective temperature feel much colder, and it cools you down much, much faster. This dramatically increases the chance of frostbite, even if the thermometer doesn't show an extremely low number.
Wow.
Yeah, even a slight drop in your actual skin temperature in windy conditions can massively boost your risk.
So even what feels like moderate cold, if there's a strong wind, can actually be quite dangerous for frostbite.
Exactly right. And beyond just clothing, the sources highlight simple behavioral stuff too.
Like what?
Staying hydrated, staying well-nourished, avoiding alcohol and smoking both constrict blood vessels, which is bad for circulation to extremities,
Makes sense.
and using a buddy system. Watching out for early signs of cold injury in yourself, but also in others. White patches on the skin, numbness.
Good advice. So what does this all mean? Taking this deep dive, looking at all these sources, it really shows frostbite is this complex injury.
Driven by those ice crystals, the vascular damage, and it can have potential long-term impacts way beyond the initial damage, cold sensitivity, chronic pain, things like that.
Yeah, and from its, surprising historical role in messing up military campaigns to modern medical classifications using scans and these promising treatments like the clot-busting drugs, there's definitely a lot more depth here than just, ouch, I got cold.
Absolutely. And the critical importance of preventing those freeze-thaw cycles, that really stands out. Plus simple stuff. Layering properly, managing wind chill.
It does raise an important question, though. Considering how vulnerable our exposed skin actually is, and the potentially serious lasting consequences of frostbite, how much more proactively should we all approach prevention, even when the cold conditions seem only, moderately severe?
That's something to think about, definitely. Next time the temperature drops and that wind picks up.